Would free healthcare lead to longer waiting lines?
If you think it's fun to wait in line at DMV, you're going to love Bernie Sanders' wait times for Medicare-for-All.
So far on Medicare-for-All Mondays, I've covered a lot of the smaller and weaker arguments against the United States adopting a free, single-payer, and universal healthcare system, often called Medicare-for-All. But today, I'm going to address probably the best argument against a universal healthcare system: waiting times.
And with the government takeover, we can see from other countries that we're going to have long wait times and rationing of health care.
We all know what happens with socialized medicine: rationing and stagnant care. In Canada, wait times to see specialists have skyrocketed more than 125%. And you have to sit on your abscess for an average of 4 months to see someone about your cancer or infection or bum knee. You think millennials want to wait for any kind of medicine or procedure, let alone an Uber? Not a chance!
Now look, it's actually true. Countries that have a universal healthcare system do have longer waiting times for some types of care. But think as to why that is. They have longer waiting times because poor, sick people can now access care that they otherwise would not have sought. In this country, we pay for our shorter waiting times with more death. Wait times are the result of rationing. Healthcare is a limited resource. As long as there is scarcity, there will always be rationing. The question is, how do you want to ration care? Other countries like Canada, the UK, Australia, etc. ration care based on need. The people who need care the most get treated first. There is a line, yes, but your place in that line is determined by how urgently you need care. Yes, some healthcare procedures have extremely long waiting times that are several weeks longer than in America. However, the more extreme examples tend to be for specialized elective procedures that are not life-threatening, like knee surgeries and hip replacements. If there's an emergency and you need care right now, you can get treated right away. Wait times exist in America too, and sometimes you have to wait because you can't afford the care. In America, your place in the healthcare waiting line is determined by your ability to pay. According to a 2022 Gallup poll, 38% of Americans said that they or a family member delayed or skipped medical treatment due to cost. Fewer people seeking care means less of a wait, but the cost of that is millions of sick people going untreated. Are you okay with that? A lot of Medicare-for-All opponents like to bring up Canada as an example of absurdly long wait times, but it's important to note that Canada is the most extreme example. They have long wait times not just compared to the US, but compared to most other developed countries that also have a universal healthcare system. As said in a previous episode, wait times in Canada vary wildly by province depending on how much they spend, and many healthcare experts believe that the Canadian system is underfunded.
The Canadians are too cheap about it. They just don't spend enough on healthcare to have a lively system. Some provinces, like Saskatchewan, where this started, have shorter waiting times for both acute and elective treatment than most of the United States. So there are parts of Canada where it works.
There are many things that Canada can do to reduce wait times, and it's not just increasing funding. Administrative reforms like revamping computer systems, reducing physical paperwork, coordination between different physicians, using better queuing techniques, and improving telehealth services could all massively increase efficiency. Artificial intelligence could also play a role in reducing wait times in the future.
And those are the kinds of solutions that we are moving to in Canada. When we've moved in that direction, it's made a big difference in our waits, but we're not there yet. And as you've said, no system is perfect, so these are the kinds of issues that we struggle with.
As long as healthcare is a scarce resource, there will always be some type of rationing. My question is, what country do you want to live in? A country in which healthcare is rationed based off of need or your ability to pay? I want to live in a country where the people who receive care first are the ones who need it the most, not the ones who have the biggest wallets. Nobody should be able to buy their spot in the line. It's not a perfect system, but it's a heck of a lot better than what we have now.